Go
Hi,
ahead.
I'm Tammy Fontana with All in the Family Counseling Center Private Limited and my New Beginnings Club. Today I'm doing a talk and an interview with Dr. Dunja Gorup, and I'm really excited to have you today. Thank you so much for joining us. Dr. Gorup graduated from the University of Zagreb School of Medicine in 2008, and in 2009 she started a PhD program in neuroscience. She works as an assistant professor at the Department of Histology and Embryology, University of Zagreb School of Medicine, and in the Laboratory for Neurogenics and Development Genetics at the Croatian Institute for Brain Research. She is involved in the collaboration with the Department of Anatomy and Physiology, Laval University, Quebec City, Canada, and her research interests are in the field of recovery and regeneration after brain ischemia. I hope I said that correct. So she is somebody who knows what she's talking about. and she's also, I know, is a professional athlete. And the reason why I invited her to speak today, and I'm so appreciative of your time, and we've been talking and planning this, is as a therapist and working with a lot of my clients who get a lot of physical problems from mental health, I was very interested in talking to you about the mind and body. Busting some myths about exercise and just talking about gut health and about how physical health and sexual health go together. So we'll have sort of a free-flowing conversation. Dunja, if you want to just introduce yourself and give us a little bit more, because again, you're somebody who really knows what they're talking about, and we're really excited to have you.
Well, thank you very much, Tammy, for having me. And I really appreciate your efforts to bridge this gap between the clinicians, between the doctors and the clients, I should say, not only patients, because the doctors are unfortunately a little bit limited only to serious conditions and not really there. As doctors, we don't have so much time for prevention or maybe improving the quality of life. So I think you do a great job by bridging this gap.
Great, thank you.
At the moment I'm in the UCL. So I work as a research fellow here in London on the topic of glioblastoma. So we are investigating brain tumors and how can we model their development in human brains, which is also very interesting. But since I have some background in sports and I had a lot of success even in professional sport, I think I also have some background to talk about the importance of physical activity for overall health, not only if you suffer a stroke or if you have a brain tumor.
Exactly. And I think, yeah, that's important because most of my clients and people that are watching this, hopefully we want to prevent them from ever getting to that point. What sport did you do, or what sports did you have? Were you a professional in, Dunja?
Well, the most success I had in boxing, which is a bit strange in Croatia. It's not very popular. Female sport is not very popular at all in Croatia. So the boxing, it was somehow cultural and social challenge. But I had a lot of success because of my scientific approach to the training and preparation for the matches. And after I quit boxing, I retired. I continued to do some more aerobic exercises such as triathlon. So I also made international team for triathlon.
Oh, great. I know Croatia, it's a small country, but it produces some an extreme number of top level athletes. So Croatia is doing something right. I don't know if it's the water or the food or what, but there's a lot of top athletes coming out of this country.
Yes, it's something phenomenal. Yes. Well, I was never on this kind of level like Ivanišević, for example, or yes, some other famous athletes. But we could say that almost everybody in Croatia in their family has a person who has a medal from Olympics, which is strange. Yes,
yeah, it's a small country. Well, one of the things that we were talking about when we were preparing for this and I was interested in is, a lot of my clients are working in finance and baking, and people are working, really long hours, upwards of 50, 60, sometimes 70 hours. And so there's a lot of myths out there around, training and intense training. And right now what's really popular in Singapore and some of the places are this HIIT interval training, this high intensity, 45-minute training. And a lot of people have these ideas about, if you don't kill yourself, it's not counting. And it was really interesting when we were talking about kind of breaking down this myth about really what is good for your body, especially if you, are sitting a lot or you're not training. What is, breaking down some of these myths about HIIT versus what really is good for your body.
Well, yes, it's very interesting because there was a certain recommendation that like 10 years ago from different cardiac societies, like American Cardiac Societies and like that, that if you do a vigorous exercise for a shorter amount of time during a week, you compensate for sitting or not doing more moderate exercise. So if you do vigorous exercise for like 20 minutes a week, you are fine. But lately there have been some more research has been done on the topic, and it was realized, scientists realized that it's actually better to spread your exercise during the week, to have it moderate or even below moderate intensity. It's much more.
And moderate might be something like walking, just so we help people understand. So moderate might be walking at a brisk pace where you can talk, but
yes. Maybe you can't sing, but you can talk. Yes.
Yes, you can't sing, but you can talk. Versus HIIT interval, you can't talk, you can't sing, and you're barely can't catch your breath.
Yes, but we have to think about why was HIIT exercise invented in the first place. So the first form of HIIT exercise was developed for ice skaters, the Olympians actually from Japan. So Tabata, you maybe know Tabata version of the HIIT exercise. So this was targeted population to do this Tabata exercise were already very fit individuals who had great great volumes of training during the week.
So that's very interesting. So in other words, this HIIT and TABATA was specifically designed for a population of professional athletes. It wasn't designed for lay people who are weekend warriors or who are not at Olympic level conditions.
Well, they wanted to optimize, yes, their time because at a certain point they couldn't increase their fitness much more by just spending more time during regular exercise. So that's why they made this Tabata sequence, we could say, yes, or the short intense burst. But I must say those were people with completely healthy heart, so circulation was on the top level and mostly below 30 years of age. So
from a scientific level, what happens to somebody who is sitting 40 to 50 to 60 hours a week at a desk, is maybe overweight by 5 to 10, has a belly, who doesn't have a lot of core muscle strength, and then they start doing these HIIT intervals. What are some of the risks, or is there a benefit from injury or versus doing more moderate regular exercise on a daily basis?
Well, you can imagine how that's a tremendous shock for the body. And people think if we shock our body, then we will start to lose weight, we will decrease our fat and all that. But if you shock your body, you just put your hormones, your endocrine system out of the balance, and your adrenaline and cortisol that accumulates during this stressful period, which is nothing else but a fight or flight reaction, makes you stressed more and makes your metabolism even worse. So
that's really interesting, because a lot of my people that are coming into me with mental health issues, of stress, of anxiety, they have a lot of autoimmune issues that are resulting from chronic long-term stress or early childhood trauma.
Yes.
So in other words, doing these HIIT intervals is actually not good, because it can actually further create your stress your endocrine system, further stress you, and kind of works against. So again, I think one of the myths is this idea of shocking your body, if I'm hearing you, is not necessarily good. It's like long, regular, sustained exercise. I know when we were preparing, you were saying sometimes even if you're doing 10 or 20-minute exercises multiple times during the day, going for walks, stretching.
Exactly, yes, yes. Yes, that would be a good solution. So maybe just put a timer on when you are sitting on your desk to be aware to get up from your chair for every like 30 minutes, half an hour, and then do like 5 minutes walk. If you're grabbing a tea or coffee, if you're having a coffee break, then just go for a bit longer, 5 minutes, 7 minutes walk. Or if you have to go to the upper floor or somewhere, don't use the elevator, just use the stairs. And if you want to talk to your colleague, don't send him an email, just walk to their table, for example. That's a good solution. And I've noticed many people in the offices now use the elevated tables and they are working standing up. So you can use it interchangeably with sitting down and standing up. Because there's a true problem when you are sitting more than 4 hours. That's what scientists can measure. But I think even shorter period, like 2 hours, changes your metabolism so one enzyme that it's lipoprotein lipase, for example, but this enzyme is important for degradation of lipids. So the usage of lipids in your for energy production.
And lipids are fats, are types of fats that are sitting in your body, correct?
Yes, you're right. So the fat is then the metabolism of fat is decreased by 90% after 4 hours of continuously sitting. But if you just make a short break and do some activity, you don't have to fall that flow with your activity of the lipoprotein lipase. Yes.
So summarizing again, like if I put what I hear you saying is like, and for my clients is this idea of all or nothing, like either I have to kill myself, like you said, shock the body, is actually not good for you, especially my clients with a lot of stress. You're better off doing low intensity and actually sustained, and multiple breaks throughout the day are going to help maintain your metabolism, help probably maintain your overall well-being, and not stress your body or shock your body, and actually probably help lower stress versus not exercising and then shocking your body with a HIIT interval. So small doses.
Right, yes, because the problem is.
Go ahead.
Sorry. Well, if a person who is sedentary most of the week would try to do a Tabata interval properly, I don't think anyone could do it. You know, you have to be really fit and you have to be warmed up to start.
Yeah, it was designed for professional athletes, which, you know, people are doing this or not. And then there's marketing just because people are selling it. It's the same thing in mental health. You know, there's all these coaching and all this different stuff, which it's, you know, it can be more harmful. Just because you can sell it or you can buy it doesn't mean you should be doing it.
And it could be especially dangerous for the circulation system, for the blood, for the heart, because this is intense training, intense schedule, which increases your heart rate beyond any tolerable levels. So if you're not a trained athlete, having your pulse beyond 160 in your, let's say, mid 30s is really not useful.
And most of my clients are somewhere approaching 40s or in their 50s. So if they're not in shape or they haven't done it and they're drinking, it could be very dangerous. Can you just explain a little bit, because some people may or may not know about it, because I do have a lot of clients who are coming with, they have stress from their childhood. They're coming to me where they're having a lot of stress. I have a very high percentage of my clients with endocrine system issues. Like they said, they'll have Hashimoto's disease. So I think that's why it's interesting again about the body. Can you just explain maybe to lay people what the endocrine system is and what stress, how that's connected to stress and exercise and well-being?
Yes. I'll try not to be too professional because we give a lecture on this topic.
Yeah, I know. You're used to talking to other scientists, and today you're going to be people who are non-scientists, finance people, bankers, insurance people. This is who will be listening. Dumb it down for us.
Maybe, well, we try to analyze everything in medicine to separate in its own boxes, you know, like the hormones are on the one side, neurons and central nervous system on the other side, and then what else, circulation on the third side and all that. But now we have a new discipline that integrates all that, which is called Psychoneuro Immunology, which tells us basically that hormones are affecting our nervous system, and then our nervous system and hormones together affect our personality and behavior and psychology. So, I mean, this is something that the old civilizations were preaching about, you know, Europe, we have increased this concept of mens sana in corpore sano, so the healthy spirit in the healthy body. But hormones are something like neurotransmitters, so like communication molecules for our endocrine system, which is the glands, such as thyroid, for example, in the Hashimoto thyroid gland, then the pituitary gland, which is important for regulation of sexual hormones. And so they spread around the body through the circulation. And then they affect the targeted tissue, which has a receptor for it. So what we noticed is that sexual hormones and the stress hormones have receptors for them in all tissues. So when you have stress reaction, you are not just experiencing it in your muscles or in your, I don't know where, in your legs when you want to run from any kind of threat, but also in your brain and in your testicles, ovaries, wherever this cortisol is coming to. So the trouble is, I'm mostly interested in the brain. So what we recognize really early on in science is that stress reduces the capacity for memory, the long-term memory, and because it shrinks down one area which is very important for storing memory. So you can have problems with recalling some memories from the past. And if you remember, if you think just about how you feel during the stress, you can't really think about anything else but the present situation.
Yes.
But you don't want to be always in this reaction. You want to be able to integrate your experiences with the present problems and challenges that you face.
Right. So the endocrine system is really a reaction. It's a hormone system. It's something that either regulates our reaction to stress. It's sort of the glands and the communicator of having our body is reacting. And basically, if I bottom line it, if too much stress or ongoing stress makes you dumber, makes you slower, and kills your sex life. And I think it's interesting because I have a lot of clients who endured a lot of early childhood trauma, complex developmental trauma, and they often have difficulties recalling a lot of things in their memory, which in studying trauma, this is one of the things, the memory gets distorted. As a clinical, go ahead.
It's interesting that in males, for example, this happens during the PTSD, post-traumatic stress disorder, but in females, it's mostly recognized in depression. So the depression has the same effect on the brain as the PTSD regarding this effect of the cortisol on the brain. So the thing is, the brain integrates all the environmental
experiences. Yeah, basically internal, external.
Yes, all the sensoric experiences that are coming to your brain are being integrated, and then they come down on the level of hypothalamus and hypophysis, or the pineal gland, and then the hormones are being released. And these work much slower, but in a long term compared to our motoric actions. So what we can, when we move our hands or all that.
So if I kind of summarize, and then I'm going to transition a little bit, but kind of bringing this back, why I want to ask about the endocrine system and our stress levels, is that, again, the mind-body connection, that, again, breaking through this myth that if you really want to be healthy, what I'm hearing is, especially if you're not a professional athlete and you're over 30, this idea of HIIT interval training or making yourself suffer or shocking the body, this actually isn't healthy on a number of levels. One, it's not healthy from getting in shape. Two, it's really bad for your mental health because you're shocking the body, you're inducing stress, which is, again, taxing your endocrine system. Aside from maybe putting you at a higher risk of heart attack or stroke, you're also making yourself dumber because you're, again, stressing your body, increasing stress hormones. I'm kind of summarizing in a thing, but this HIIT interval, or this idea of like intense suffering when you exercise, is a myth that needs to be kind of replaced with, regular moderate exercise throughout the day.
The problem is is when they did the research with HIIT exercise, even with fit people, what they realized that after 3 weeks of HIIT exercise, they lose their immunity. So they get prone to colds, to flu and all this stuff, because the cortisol, which is then high in your system, just inhibits the action of the white blood cells, which are the first line of defense against viruses, colds, and all this stuff. So if you are constantly exposed either to stress, which is as well the strenuous exercise is a kind of stress, which you are not used to, then you actually challenge your immunity as well. So you can, first I would say one should be aware of its physical fitness, and then regulate its exercise accordingly, because sometimes you may really profit from this HIIT, especially if you want to boost your explosivity or fast reactions, or if you are a professional athlete, definitely there are benefits. But if you just come straight from your chair, from sofa, then I would suggest doing it slowly. So be aware where you.
So in other words, if I hear what you're saying from a practical standpoint, people should really probably get a medical exam and get some professional guidance, maybe on shaping their exercise according to their current fitness level that they could carry on. But again, it's not, again, I think the main thing what I'm understanding is this idea of shocking yourself or being in pain is, unless you're a professional athlete, like I said, most of my clients are not, is actually harmful on multiple levels, and probably not sustainable. You can get sick more.
No, it's not. It's very hard to sustain this intensity of physical activity, even as a professional athlete. First, as a boxer, I had to do regular checkups every 6 months. So I had to check my blood count. I had to check my ECG, all of that before I could enter in. Even though I had to check my dental, how should I say, card chart had to be updated, all that before I could prepare for a match. So because it's a tremendous risk for cardiac ischemia or overtraining. So the overtraining syndrome is something that all the professionals are fighting with, and the people who are like amateurs and try to do something very intense just go straight to overtraining their bodies.
Can you tell me, because actually I have several clients. One component of my clients is some people regulate their depression and anxiety through drug and alcohol, and then I have other clients who regulate it through a lot of exercise as a way of managing their stress and anxiety. So they are often getting sick. What are the symptoms of overtraining and the risks?
First, what you notice is that you are very tired, and then you are prone to infections such as even candida as a simple infection, and like cold sores, and you have trouble recovering your body after exercise.
So you're tired, you're maybe more achy because your body's tired. Even when you sleep, you don't feel rested.
Yes, exactly. You can't get enough sleep because your architecture of sleep gets messed up, and the heart rate is the most indicative, because even when you're resting, you don't have a normal heart rate, it's elevated. And then you see it when you start to exercise that it increases, but not in a way that you were used to when you were fit. So sometimes usually the professional athletes know their pulse rate very well, so then they can notice the difference. Either it's raising too slow, or either it increases rapidly. So those are all the signs of overtraining. And this is a complex syndrome which affects all the organs in the body, not only your muscles. It affects the liver, the brain, and your immune system.
So again, if you're overtraining, because again, like I said, I have had quite a few clients who use exercise. So if you're getting sick a lot, if you're tired, if you just feel like you can't recover, you're not rested, you're kind of low in motivation, even when you're exercising, you just don't have that energy. They're not professional athletes, so they're like, they're probably overtired and probably just need to rest and find alternatives. I want to pivot a little bit because as a clinical sex therapist too, working with people, one of the things I think people really underestimate is about physical fitness and sex. I think people forget that sex is actually a physical activity. And I was really interested when you're talking about the stress hormone, how it affects the endocrine system, because I'm always telling people you can't have the thing that goes away when you're really, really stressed is, your sex life, because the sex sits in the limbic system. You're not designed to have sex when you're feeling under threat. And I don't know if you can talk a little bit about, physical fitness and health and mental health and stress as it relates to, because we were also talking about the psoas muscle, which is a big muscle in the body that connects, and how tightness in the hip, tightness in the pelvis can affect sex. So I'm kind of throwing it out there. So anything you want to jump on or target.
Yeah, previously we were talking about the brain and body balance. And yes, so lately I see that this balance is shifted more towards the brain and towards the mental activity. And we are somehow forgetting our vehicle, so that we also have to maintain. And especially when we are sitting down, this psoas muscle, which is the hip flexor, which is one of the biggest muscles in our body, but we can't really sit because it's deep in the body. It becomes it becomes contracted.
Yeah, shortened, I heard, like when you sit. So, because if we're standing, it's supposed to be long, but when you're sitting all the time, they get shortened, because if we're standing, but then when we sit, and it's one that hooks on the hips and then goes to the lower back. So when you get lower back pain.
You got the pelvis tilt. You got the pelvis tilt towards the front, and then the lumbar spine, that's also more concave. So that can make a protrusion of lumbar discs. You can be more prone to lumbar disc protrusion. And the other thing is, if this muscle is very tight, the circulation in the pelvis is disturbed. And if you want to have a proper hydraulics or whatever you require for the reproductive organs, if you want to have them nourished properly, you can't have obstruction or the deterioration of the pelvic circulation. So
putting in lay terms, basically, if you feel like lower back pain, you feel very tight in your pelvis, you're sitting long hours and you're hunched over, this is going to shrink all your muscles, and probably you're not going to be fit. This makes, because sex is a physical activity. I often see how people really kind of forget that sex is actually an athletic activity. Even if you want to do missionary style, or even the most basic thing, there is a certain amount of physical activity and physical fitness required. So if you're a bit overweight, if you aren't stretching, if you're having a difficulty in doing any kind of physical activity, sex is going to become really difficult. Plus, the fact of, you're getting more stress if your body's in pain, already not having sex, this is going to be very difficult.
One might become really reluctant to do this kind of activity because of all the problems that are coming with activation in this area. Yes. So,
and any kind of pain, like, because again, this is probably out of your scope of competency, but generally pain in the pelvis or hip area for men or women could represent probably in more contraction or discomfort just in general, making people more tense. Where if women are tense, they may feel more vaginismus, tightening of the vagina, and men may have difficulty with erections because they're tired, they're stressed. And then the problem.
You have a good point. Yes, I can see the connection what you're saying, because between the two layers of the psoas muscle, there is a lumbar plexus. So all the nerves that are how should I say, innervating this area, whether you want to have them sensoric to feel something from this area, or motoric, or some kind of secretion to have the reflexes, are passing between the two layers of psoas muscle. And if it's stiff, you can expect what's happening. The area can become completely numb.
Yes. And then you're not going to feel anything, or pleasure or pain. It's probably going to be more pain. The other interesting thing too, when we were talking, I was researching this quite a bit, is I guess it's fairly common knowledge that the psoas carries all the emotional tension for people.
Well, it's very interesting that you mentioned it because there have been lately a panoply of techniques for releasing this tension from psoas, and well, I've been interested in this area a lot, and I noticed that it might be people are focused so much on psoas because it's such a huge muscle and it's deep in the body. So some deep emotions are stored there, but you can notice this also on your tonus of your peripheral muscles, even on the hand and neck. I usually have this, for example, on my quadriceps on the legs, because those are the muscles that are really affected by stress. Those are the ones that get activated very soon, very early in the flight or fight.
Yeah, your body, your neck tension, because your body can't the mind doesn't differentiate between emotional stress or some external thing attacking you. It's stress is stress, so the body just reacts accordingly.
So the body sends this reaction towards the muscles, and then if you don't spend this adrenaline in running or some kind of physical exercise, the theory is somehow gets stuck in there, especially in the psoas muscle, which is not being used for the hip flexion. And then when it gets stuck in there, there is this stiffness, all these problems with the circulation.
Yes, I see this again because of the population I'm working with. I have a lot of people with complex developmental trauma, stress. Almost all of them have physical complaints, really tight, stiff bodies, constant chronic pain, tightness in the neck, always like varying intensities that react to pain, but they never can relax, like their body is storing this memory. And lots of people of my clients with chronic back pain.
Unfortunately, medicine didn't go that far in understanding this interaction of, your overall personality and your posture. So we tend to just focus on, like, if you have some kind of paralysis, then
to the extreme,
exactly, extreme point. And those things that when you have some kind of stiffness and back pain, okay, we'll just send you have a massage and physical therapy and all that. We never address the mental aspect of this, which is very significant and which is probably the main cause of all this stiffness.
Yeah, I have a lot of clients that as we work and get them better with managing their stress and anxiety, they often notice a decrease in physical pain. And then they have to work on, because then again, when you're having pain, you have to work on correcting it, because a lot of times the stiffness, the tightness, it's all linked, gets them using wrong muscles, because something's tight, so then you have a wrong muscle compensating. But the most important thing, like if I kind of just loop it all together, is start moving, but first get assessed. You don't need to kill yourself, especially if you're already under a lot of stress. It sounds like, walking, moderate riding, cycling, and it sounds like just kind of moving multiple times throughout the day is really important, for mental health, for stress reduction, and improved sex life. I mean, we do need to be in shape. I have a lot of people who are, they got bellies, they're just, they're not, and you're not going to have sex, because a lot of people want good sex, and somehow they just don't see this whole connection with the body, because the body is the tool for sex, the body and the mind,
Yes. Well, it's funny, since I'm now in London, I see many double-deckers driving around, and it was first noticed in 1950s in double-decker drivers compared to their conductors, that they have a double rate of cardiac infarctions compared to the conductors. Because what did they do most of the day? 90% of their day, they were just sitting, while the conductors were climbing more than 900 stairs a day. So already then they noticed the relation between the physical activity and overall health. And I mean, if you want to have any kind of exercise or even sex, you have to have a tough, good heart.
Good heart and flexible body, and you got to feel comfortable. I don't know if we have time. The one last thing I was just kind of curious to touch on real quickly, and it's again another pivot, is on the gut health. It was very interesting. Again, we were talking about, the second brain is in the stomach, the number of neurons, and some about the gut health. Because again, a lot of my clients, stress, trauma, a lot of stomach problems, a lot of reflux,
Yes.
because we feel everything in our stomach.
Now it's very popular to see the gut-brain connection, and intentionally gut is put here on the first place, not the brain-gut, but gut-brain. There is, of course, the other way around as well, but gut-brain is understood as the more important direction where everything's happening, because as you noticed, as you just said, we tend to feel through our bellies, and there was a lot of research done in army, in the submariners. So the people who went under a lot of stress and who were isolated and confined in a small area where they couldn't move, they couldn't do any physical activity, they noticed they don't have a bowel movement. They lose the bowel movement, and then that affected as well their immunity. So
yes, I have a lot of people with bowel issues, constipation, just difficulty. With that. And again, because everything gets slowed down due to the stress, and if you're not moving and if you're sitting all day.
And if you are in a confined small space, that produces another type of stress than being threatened by, I don't know, like we used to be threatened by the predators. Now we are threatened by different stressful
deadlines, triggers. Working in stressful offices, cold, like, windowless offices.
Some people get stressed only when they hear new email coming.
Exactly.
So when they see blink, it's another adrenaline jump for them.
And also the disconnect, I think, from nature. There's lots of studies, which is sort of a different topic, but being in these concrete jungles, working 12 hours a day in windowless office or artificial lightning, not seeing trees.
Oh yes, as a Zeitgeber, sometimes that gives you a circadian rhythm, where then you have a normal bowel movement, like first thing in the morning and then somewhere in the middle of the afternoon. So, but if you don't have this Zeitgeber, which means a trigger of your circadian rhythm through the sunlight, then all these gets messed up and out of the balance.
Yes, I was reading this. A lot of times what I'm recommending to some of my clients is if they can get out in the day, you get morning sun, you get afternoon sun, because just to help link your body, because all this is very important for your eyes to see.
I just want to make one very important point, and this is, there are these gyms 24 hours open, that are open for 24 hours, and there has been a lot of research for the people working in the night shifts, proving that there is actually more oxidative stress and more cancers in those people who are working during night. And I'm not sure whether this refers as well to the people who are working out during the night hours, but I would say that it's not really optimal time to do any kind of exercise.
No, and again, I think a lot of people, I see a lot of my clients, part of it is just the globalization, because a lot of them are based in Singapore where they're working US hours, but a lot of people cut out sleep, and they think, I'll cut out sleep to get more work done. And what do you think about that in terms of your health and fitness and
Well, lately it's been proven that the amount of sleep affects the activity of your white cells, so white immune cells. So if you cut out sleep, you can expect various colds, and not only colds, but even a proper flu or infectious mononucleosis, for example, syndrome, which then dampens your productivity more significantly than just taking a proper night's sleep.
So getting sleep is not something, or cutting out sleep should not be a go-to solution for creating more time. I know it also makes you dumber because you're slower. You just can't process things
almost
faster.
Like you're drunk.
Yeah, they've done studies, because I work a lot in sleep, that at some point you can become psychotic. Like it reverses, but when this is like the test that they do with the military, where they cut out sleep to see how they can manage. And then also too, I know there's an amount of sleep you have to get, like I think a minimum of 6 hours to release a hormone that helps with appetite suppression.
I actually collaborated with Croatian Army when they were using an application for making schedule for the pilots, because when pilots go into some kind of military action, they have to be well rested, otherwise they are almost like under influence of 5 promils of alcohol. So then you enter all the data of when the pilots were in their mission and when they were sleeping, and then you get some kind of result that tells you how well rested the pilot is. And then if it's not well rested, you can't let them go into another mission. So it's very important to have this your sleep, regular sleep. Yes.
Yeah. Well, I'm going to conclude here, but it sounds like, again, the body is a big contributor to mental health. And I think a lot of people want to break these things apart. But, you know, again, what I'm hearing from you is that we really need to take care of our body and take care of it in a proper way. So, you know, getting properly assessed to see what's your physical state before starting work. And, you know, you don't necessarily need to suffer or shock your body to actually get results from a mental health. And sleep is important for overall well-being, and the healthy body, being fit, lowering stress is important for sex as well, which is a part of good overall mental health.
I would say you summarize it pretty well. Yes.
Yeah.
I think, yes, that's more or less.
Yeah. So we really, if we want to be mentally healthy and happy, we cannot neglect the body. There's a direct connection. You know, we have to start to think of ourselves as whole beings, not kind of parsing things off. And
yes, we should actually use our body as a good sensor for everything that's surrounding us, and as an integrator of our experiences. Yes.
Which is great, because that's something I'm constantly teaching my clients, you know, because that's all getting back into feelings. You need to connect to your body. You need to connect to your feelings. You need to feel the stuff in your body, in your shoulders, in your neck. All these things are giving you feedback about your unconscious, about what's happening to you. So there's a real, you know, this is really a nice scientific medicine message combining with mental health, that we need to be integrated in everything, not blocking things off and ignoring things. It's all powerful information.
And when you get intuitively to this level of understanding of your own body, you don't need any kind of application or program that will tell you when to take some sleep, when to have exercise, because you will have the awareness of your circadian rhythm.
Which I think is important, because everybody's body is different. There's no standard template. You know, this is one of the things I'm telling you. Everybody's feelings communicate one way, your body communicates in one way. So yeah, it's most important to learn your own body and not be afraid of it.
That's the challenge in sport. That's the challenge as well, because you can't approach every sportsman or sports pro with the same program, because it will work only for certain people. And if you want to be the most successful in your own body, you have to develop your own program.
Yeah, that's great, because that's exactly what therapy is doing. Everything is custom to the individual. We have kind of guidelines, but then we drill down and figure out each person. Well, thank you so much, Dunja. This was really informative, and I'm very grateful. Thank you so much.
I think you did a great job, Tammy. Thank you very much.
Thank you. Bye-bye.
Bye.